If you don't want to give your customer a lifelong penalty, you need to know this important piece of information. Retiree coverage does not exempt your clients from the Medicare Part B late enrollment penalty. This is super important that many agents forget to mention, and it can lead to significant financial repercussions for your client. Now, you might be thinking, what about Medicare Part D? Well, here's where it gets kind of interesting. Retiree coverage can protect your clients from Part D late enrollment penalty, but only if the coverage is considered to be creditable. This means that the coverage must be at least as good as Medicare's standard prescription drug coverage. It's a detail that's easy to miss, but can make a world of difference. I was reminded of this just the other day while advising a client who's part of the Federal Employees Health Benefits Program, FEHB, with Blue Cross Blue Shield. He's about to turn 65, but his spouse is still a few years away from Medicare eligibility. In their case, staying on the FEHB plan was the best option so that he could ensure that his spouse wasn't left seeking coverage through an ACA plan or something similar. He decided to stay on the plan, but was considering not signing up for Medicare Part B. But that's when I had to kind of step in and explain that the late enrollment penalty is something that could really affect him. Many agents forget to inform their clients in similar situations about that penalty, but it's a pretty important oversight because these penalties are not just one-time fees, they're lifetime penalties that can significantly impact a client's finances in the long run. Understanding these nuances is vital. As agents, we need to be well versed in the specifics of different types of retiree coverage and how they interact with Medicare. This knowledge allows us to provide the best possible advice to our clients, and it's going to be tailored to their unique situations. Let's go ahead and delve deeper into the late enrollment penalty for Part B. If your client delays enrolling in Part B, they'll face a penalty of 10% for every month that they could have had it, or every year that they could have had it, but then chose not to. And this penalty continues as long as they have Medicare Part B. Imagine that financial impact. Remember, that's not the case if they're working and they're on employer coverage. For Part D, the calculation's a bit different, and the penalty is calculated by multiplying 1% of the national base premium times the number of full uncovered months that your client was eligible but didn't enroll in Part D or have creditable coverage. This amount is added to their Part D premium again for as long as they have the coverage. So what should you do as an agent? First, you got to ensure that you're asking the right questions about your client's current coverage and their plans for retirement. Understand the specifics of their retiree coverage and whether it's creditable for Part D. You got to educate them about the implications of delaying enrollment into Part B and D, especially the lifetime nature of these penalties. Remember, our role as Medicare agents extends beyond just enrolling clients in plans. We're here to guide, educate, and protect them from potential pitfalls in their Medicare journey. Hey, before we wrap up, I want to remind you to like, subscribe, and hit the notification bell for more content like this. We're committed to providing you with the knowledge and tools that you need to succeed in Medicare sales and to serve your clients effectively. Thank you so much for joining us today. Until next time, keep learning, keep growing, and let's make a difference in the lives of our clients.